If I sum up my experience and compare my college with another college, I have seen my college grow in front of my eyes. From the year 2012 till the year 2018, I have seen my college grow.
Hi guys, and today we have a special guest, Dr. Rahul Bharatiya, a MBBS graduate from KPC Medical College and Hospital, Kolkata. Thank you for joining.
Hi Shivam, hello everyone. This is Dr. Rahul Bharatiya. I'm graduated from KPC in the year 2018. I'm very honored to be right now talking with Shivam, and very grateful to be sharing my experiences about the college and whatever doubts and questions he will have.
Okay, that's great to hear, and we will definitely have a conversation with Dr. Rahul about his experiences there. So let's begin. Firstly, how was the first day at your college, the first time when you entered college? How was the day?
To be very frank, magical, because it was a dream for me to become a doctor, since I belong to a family in which everybody is in the medical profession. My mother, my father, my brother. So it was a dream for me to be in the college for the first day, and little bit also panicked because in the college it was a huge amount of crowd which I was seeing for the first time, staying in the hostel for the first time, where there are 200 to 250 people together staying, and in that senior, junior, everybody was there. So yeah, it was a mixed feeling, and due to some railway issues, I joined my session of the college 4-5 days later. So it was a very mixed feeling for me.
Okay, that's great. And how is this college of KPC Medical College and Hospital different from the other colleges in your state?
See, if I tell you, no college in MBBS courses, no college is different from another college, because they all are providing the same education like other colleges. But yeah, infrastructure wise, if I tell you, KPC being a semi-private hospital and a college, it has a better infrastructure. When I went into that college, yeah, I heard about Calcutta Medical College also in Calcutta, which is one of the best government medical college with one of the finest infrastructures and everything. But yeah, getting into KPC was a feeling like we were having a good infrastructure, we were having a good stay in the hostels. If I sum up my experience and compare my college with another college, I have seen my college grow in front of my eyes. From the year 2012 till the year 2018, I have seen my college grow from infrastructure, in aspect of infrastructure wise, in aspect of the education, plus all the activities which was going on in our college. So yeah, it was a very good experience, and I have seen the college grow. So it was no college is different from another college. It's just the mother institute which you study, and you form a bond with that mother institute.
Okay, and what do you have to say about the course curriculum in your college? There's a transition, when a student leaves his school, he enters the college, so he faces a different atmosphere. So how's the atmosphere like there? Is it just like the school where you have to give multiple tests in a year, or is it comparatively a bit relaxed because it's a college life? So what do you have to say about it?
About this question, I will say that it's a very total different experience from school to college. In school, you are worried about your co-curriculums, everything, and activities, multiple tests you are giving, multiple practicals exams you are giving. College, and it being a medical college, it's totally different from school. Yes, there were multiple tests too in the college life. In the first year of my college, I have given multiple tests, and of all the 3 subjects we had, anatomy, physiology and biochemistry, and that was required because once you get into the college, you are scared because you don't know what to do, what to study, where to go, who which guy will come up and like help you out in the study, which senior will guide you. Like you're totally confused in the first few days of your life in college. So at that point, the college steps up and they provide you weekly test after a month. Then we used to have part completion exam for all the upper extremity exams. We used to have lower extremity exams. Like part wise, we used to have when that particular topics were finished. So this kind of activity in medical college is a very good thing. Yes, it's stressful also because at some days we used to have 3-4 items test of all the 3 subjects. So yeah, it was very stressful also, but yeah, it helped us a lot to grow in first year. Then afterwards we were like comfortable in the second prof, third prof, and final prof is the ultimate chapter of medical life. So that time you have to give all the tests and everything. And course curriculum wise, if I say, MBBS being one of the subjects in which you are not studying any subjects, you are taking a responsibility. And yeah, it's a very big responsibility for any human being to become a doctor, because you are treating someone who is you only, like that person is a human being and you are also a human being, and that person is coming to you with all the trust he can have on any stranger. So being MBBS, we have 19 subjects overall, because I'm giving my post-graduation exam, so I know there are 19 subjects, but there were not 19 subjects in our college that were divided, like they were combined with all the major subjects. Like we had anatomy, biochemistry, physiology for the first year. For the second professional exams, we have pathology, pharmacology, forensic medicine and toxicology, and microbiology. For the third prof, part 1, we had ophthalmology, we have ENT, eye, nose and throat, and community medicine. Then in the final chapter, we had medicine, pediatrics, OBG, obs and gynae, and surgery. In medicine, the most of the topics were covered. In surgery, orthopedics was covered. In pediatrics, all the new chapter, like pediatrics and medicines were correlated, but yeah, everything was covered. And obstetrics and gynecology was another subject we used study. But this was some of the curriculum we had, like college curriculum. Yes, it's tough for students, but yeah, it's good. You must have you should go through all the tests and everything to finally getting entitled with the prestigious award of doctor. This is a very big achievement in a person's life.
Okay, so that was a great insight into the MBBS life at KPC. Now moving on, we'll ask a few specific questions about the college. So firstly being that, tell me about the campus there.
Yeah, the campus, first of all. I'm really excited about this question because being like going there and being having a hobby of capturing memories, like I personally love photography. So looking at the campus in the first year, because it was, as I said earlier, it was growing college. It was opened in 2008, so it was a new college at that time. It was growing slowly, but it was growing. So the campus was divided into many sections. We had a hospital section. Boys hostel was different totally. We had a building which was for the professors and the doctors who are staying in the hospital. Girls hostel was totally on the opposite side near the college for obviously safety purposes, and the college was behind our hospital. Our hospital was divided into 4 blocks, block 1, 2, 3, 4, and distributed with the departments and all, everything. And we had a field when we went there. We had a football field because football is a much loved sports in Bengal. We had a very good field, like it was okay field, but eventually the college stood up and said no, we are improving it, and they made a very good field. Like students used to sit there in the evening time, they used to chat, and some students used to discuss about the study things. Other guys were just coming from the colleges and they were sitting there. Some people were playing. So yeah, as a whole, if I say, the campus was really good. For being my mother institute, the campus was really good.
It's good to see that you, being a pass out, are so fond of your campus. I'm sure that the students out there must be loving their campus too. So moving on, how are the seniors there at your college?
Yeah, talking about seniors, it's a very good bond that a junior and senior have in a college. Many juniors are scared that, oh shit, I'm going to a college and there will be seniors who will be very tough on me. They will be like taking intros, introductions, everything. Look, this thing I also had in my mind. I was also scared during the first time when I was called by the seniors. But if I tell you frankly, those seniors were not just seniors, they were like elder brothers who were standing there and they were taking introduction of me. They were having fun. They were trying to make a bond with me so that in life, in that college part, if I go and have a trouble, they are there. And this was the fact. Whenever we the first professional exam which we were giving, at that time we had seniors who came to our room and who had who were willingly, like, if you have any doubt, ask me. Or in the morning, who were getting teas for us. Like, personally, I had a senior who saw me studying in the morning and he got a cup of tea. So like, senior bonds were very good. Yeah, there were many seniors who were very strict, and these all are the different fish in a pond, and it's required. And being a senior, eventually we also try to make a very healthy environment in our college, because we know students who are coming, they are very scared. Some guys are leaving their family for the first time, so we have to make them comfortable. We also have to be harsh on them for some time, at some moment, because they need to understand this thing, that the senior is someone who has gone through many phases and then he has become a senior. So yeah, the senior junior bond in our college was very good. There was no such problem like somebody is getting ragged or something. This was totally banned in our college. Plus, we also as seniors made sure that nobody was getting ragged. So the relation was very good in our college.
Okay, that's great to hear that there's no ragging and it's a safe place for the juniors. The juniors listening to this video must be relieved now and must not be worried about this case, at least when they'll be entering the college for the first time. Moving on, please tell me about the patient load there. It being a private college and we have the other government colleges in Kolkata. So it being a private college, like, how much is the patient load? Like, could you tell me about it?
Obviously, this thing is a very good question, because a student who is joining a college, he or she thinks how much patient load is there in this college or particular thing. See, being KPC Medical College, being a semi-private medical college, semi-government medical college, and in Kolkata, as we know, there are many government colleges which are good enough to treat patient. KPC also stood very good with this thing. They also started all kinds of departments, all the facilities that a patient required at the time of admission till discharge. So the patient load, when the first batch, the 2008 batch, went into internship, they had a good amount of patient load. But when I was doing my internship in the year of 2017-18, I literally had a lot of patients in particularly medicine department. We had a good amount of patients. Surgery department, we have a good amount of patients. In ops and gynecology, there were very good amount of patients during Saturday because of Dr. S.M. Bhattacharya sir. He was a good a professor who was there. So yeah, patient load was increasing day by day. And today, if I say, I talk to juniors, they also say that yes, patient load are increasing, but due to pandemic situation, all the hospital, they are filled with COVID patients. So normal patients rush are getting less at this point of time. But yeah, the patient load is definitely increased in our college. Like, if I give you a gross idea, it's not a actual count, it's a gross idea. If I give you, there will be around in OPD, I will say, counting all the departments, there will be around 2000, like I'm giving you a gross, I've never counted how much patients are there. 2000 around OPD or day. It may be a huge amount also, but the wards in the colleges I used to see, they were all filled because of the treatment they were getting. I used to take reviews also from the patients, that how are you feeling here, like they were totally satisfied. Some were not satisfied. You know, this profession is like that only. You can't satisfy everyone. You can save someone, and yet you can be thrashed away, and you just take care of some patient, and that patient gives you all the credit. So yeah, the patient load of KPC Medical College was very good, and if someone is doing internship, he or she can have a good amount of knowledge, because we are also posted in our village posting time during the community medicine posting. Out there you have a lot amount of patients, because being in the village, that PSC, the primary health center of the village, we are posted there. We have to see all the cases there and individual level. Like we only have a senior with us who is a medical officer appointed, and we are 2 interns who are present out there. At my time, this was a kind of rules we had. So yeah, patient load and learning wise, if you say, there is a good amount of learning in our college and patient load.
So moving on, could you please tell me about the hostel life, mess food out there at KPC?
Yeah, this is one of the most interesting portion in this session, the hostel life and the food and everything. Hostel life, for everyone who is passing out from a school, from a higher secondary school to a college life, he or she is very excited. Like we boys are very excited at that age. We are going to a hostel, we will be living with all the seniors and juniors. So like, if I would have to say, our hostel, boys hostel, was basically made in a pentagon shape. So we used to call our hostel block as a diamond block, because if we view it from up from the skies, it used to look like a diamond shaped building. So yeah, and this had a very good advantage, staying in a hostel which was in the shape of a pentagon, because we were having a common field in between the hostel, and we were not separated year wise. Like first year was staying in the ground floor or the second floor or the first floor, and seniors are staying up in 5th floor or 4th floor. They were all mixed up. I stayed with my roommate in a block which was having 6 or 7 rooms, and all those rooms were filled with our immediate seniors. So you can imagine, like, staying in like being a fresher and staying in that block is, some students, some aspirants are very scared. Like, I'm staying in a seniors block, but we were very cool with them. We were like a family. Whenever we used to have any problem, we used to go to them. Whenever they used to have any issues, they used to come to us. So there was a very good ambience in hostel. We had a common mess, and out there we had put on the television, as you can say, for watching all the matches, football matches, anything. Like commonly if we used to sit there. We also had a room, or I must say a area, where carom board was kept. 2 carom boards were there, 1 table tennis was there, like for someone who is very tired or who wants to just have a recreational time, so he can come and play table TT, or he can go and play carom, or he can even go and play badminton in our college campus, or volleyball outside in the field. So summing up everything, the hostel experience was really good. Seniors were very good in the hostels. Rooms were really good, because I stayed in a room which was having 2 people. Like, we 2 roommates were staying in one room, and we have a good amount of space with furnished. Obviously, we had a bed, mattress, almirah, study table, and the chair which was provided by the college authorities, and we have good amount of electricity, light in the room. Yes, being a room, being a semi-private, there were no air condition provided, and that is okay. Air condition is not required in our medical life or any college life. because that makes you very comfortable, that gives you a comfortable environment, and you're not brushed up in this comfortable environment. So I would say this was a very good hostel in which I was staying. Regarding mess food, being a non-Bengali, being from North India and going to a part of the country where basically rice is the staple food out there, people prefer rice over roti. So I was a roti guy, but I used to love it. I used to eat rice also. I used to love eating rice, because at my home my father used to eat, my mother used to eat, even my brother used to eat rice sometimes. So I used to eat rice also. So initially in the first month, we, like most of the students, aspirants who were non-Bengali, they were having a bit of problem. But as the time passed away, we were getting adapted to the food qualities, and this was not there. The food quality was very bad. It was a medium range food, like you have to pay 35 to 40 rupees, and when I was in first year, to get a lunch, and you can get ample amount of food, like you can also get it refilled with no charges. We also had a central canteen in our college, which was providing a good food. Like you order something, you have to buy a token, you have to give it to the kitchen, and then they will provide you with the food you have ordered. So yeah, sometimes we used to go in the central canteen, sometimes we used to eat in our hostel food. Dinner, obviously, at night times we have to eat in the mess. So the food was medium, if I give you a true review, but yes, it was very good. And if you're staying in a hostel, after 1-2 months you get to know all the places around you, all the restaurants, all the mini food stalls and everything, where you can get good amount of food, good quality of food. And we as students, we are having crunch of money at our college life, so we used to save also. Like we used to eat in a small food stall. But yeah, considering all the things, so the mess was also good in our college, medium. The central canteen was good. There was also a Nescafe in our college, which was opened from morning 9 or 10 till evening 7. So we used to go there to have coffee. We used to get Maggie out there. So yeah, there were different options available in our college, KPC Medical College and Hospital. So we never had an issue with the food. Yeah, initially first month, I will say, being a North Indian, being a non-Bengali, I used to have a problem. Many other people also had problems, but then initially we were getting adapted and we started eating everything. Like we started having rice, and yeah, there was a problem for vegetarian guys who are totally veg, because Bengal being fish and chicken, mutton, all these are easily accessible in Bengal. And in hostel life, in hostel mess, veg was something which was less considered to be provided. So yeah, veg people used to have problem, but initially after few months they also were adapted and they were comfortable with the food.
Okay, and lastly, just one last question would be that what is your advice for the juniors who are listening to this video and are planning to join your college, that's KPC, in the upcoming years?
Yeah, being pass out from KPC Medical College and struggling for 3 years for clearing my NEET-PG entrance, I know the feeling. This feeling is very tough for many aspirants who are giving NEET undergraduate exams. First advice for them will be, don't be disheartened if you're not getting a choice of seat in the first attempt or in the second attempt. If you know that you have worked really hard for that seat, or if you know that your dream is to be a doctor and to serve the nation and the humanity, you don't have to think about anyone, you don't have to listen to anyone. You just have to ask yourself that will you be able to clear this exam next attempt or not. If the answer is yes, then no second thinking, go for it, take a second attempt. You will get the desired college you want. Or even if you are not getting the desired college, you will get a college, and look, in India, India is one country in which medical profession is being the tough, because we have a theory exam, like we have to study theory, we have to go for practical also. So it's a very good thing in our medical system that we are having. So advice will be this thing only, that you have to work hard. Yeah, nothing is accessible to you if you're not working hard. You are sitting at home and you are doing just nothing. You have to study, you have to know your advantages, you have to know your disadvantages. You just have to give your NEET undergraduate exam. Results, you don't have to worry about them. If you are clear, God is very grateful on you. If you are not clear, don't worry. Just talk to your parents, just talk to your brother, you just talk to your sister, or just ask yourself that you are ready for next year or not. If you are ready, then it's a very good call to take a drop and then give a NEET undergraduate exam. And now the suggestion, the advice for the people who are like we are having the NEET undergraduate exams this year on 12th September. The day after I am having the NEET under post-graduation exam. So the advice for the students who are giving this time, I know this is a situation which we were not ready for. The pandemic is going on, the pandemic is not over yet. You have to be very safe and you have to be very alert at the time of exams also. We have gone through a very rough time in this pandemic. We have lost many of our family members. I also being a person who has lost my father in this pandemic. So I know this situation is very tough for the aspirants, both the aspirants of UG and PG. Undergraduate students, they are more volatile because they have a career to build up. For post-graduation students, they have built the career, but yeah, this is the another step they are taking in their life. So for the undergraduate student, you have to be very calm at the time of the exam. You have to get a proper sleep before exam. This advices are given by all the institute, but personally, which I think, if you don't sleep, your mind won't be working at the day of exam. So you have to be very attentive in the day of exam. For that, you need a good amount of sleep and you have to eat properly at the day of exam. Don't get panicked. And the aspirants who are looking to get into KPC Medical College, people will say you that this is a semi-government college with this, that, it's not having this. But personally, if I tell you, at our time we had one of the finest faculty which was present in our college, and which were giving dedication from themselves. They were not like the student is not giving dedication, so we won't be giving dedication to them. They were dedicated to us in all the aspects. So KPC Medical College is a very good choice if you are getting KPC Medical College. And if you're not getting KPC Medical College, if you're getting any private college, or if you're getting a good government college, go and opt for it, no problem. If you're getting a private college and if you think that no, I don't want to go into a private institute, rather I will take some more time and crack a government institute, then it's your call. It's the decision which you are making. Nobody else can enforce that decision to you. And rest advices for the juniors or undergraduates, juniors who are coming in the profession which is known as a noble profession. Look, this profession is very tough. I'm not joking, it's a very tough profession, because you are having a responsibility of a human being. You are not having a responsibility of any machine. You are having the responsibility of the human being, who is the most complicated machine, I must say, created by the Almighty. And we are some medical fraternity people, like doctors, be it nurses, be it the medical healthcare providers, anybody who is related to medical profession in any way from top to bottom. I think they all are one of the chosen ones by the Almighty, because this profession is not meant to be taken as granted and as a joke. So undergraduate students, this is a very serious advice. If you are doing it forcefully. Don't do it, because you are not playing with yourself, you are playing with the guy who is coming to you, having a blind faith on you that this guy will save me. So advice is, there are a lot of advices to give, but the main advice is be positive, be healthy, take care of your family, even yourself. The pandemic is not over yet, and at this point of time we are giving our undergraduate entrance exam and postgraduate entrance exam. So we have to be very positive in this environment, and we have to clear it. If we are not clearing it, don't worry, it's not over, it's just an exam. It will be coming next year too. You can opt and give it next year and clear it. But at this time, in 2021, at this point, I must say that you have to be very positive, and like mentally and even physically you have to be very strong at the time of exam. Because, and that's it, the advice which I want to share.
Okay, so that's it for now, guys. I guess it was one of the longest college reviews, but it was a really honest interview. I have never met interviewed a person who has given such honest opinions, perspectives about his or her college. It was great to have you, Dr. Rahul, and I hope that I can interview you once again after your NEET PG results. Wishing you lots of luck for that. And that's it for now, guys. Thank you.
Thank you, Shivam. It was nice talking to you, and all the best to you also in your life. Do well and also stay safe. This is a very bad time which we are going through. So be safe, be healthy, take care of your family. And for all the viewers who are watching, please subscribe to their channel. These guys are giving very good content about all the colleges review, about multiple college review. So please do subscribe to their channel and follow them on Instagram too. These guys are doing amazing job.
Thank you.